Hello, in this video we will discuss about the yellow fever. So what is this? The yellow fever virus originated in Africa and was brought to the Western Hemisphere during the slave trade era. With the first epidemic reported in 1648 in the Yucatan. Over the ensuing 200 years, an outbreak occurred widely in tropical America, the North American coastal cities, and Europe. So, this epidemic reported in 1648. So let's begin to understand the pathophysiology of the yellow fever, and we will understand about the mechanism of the infection, but we will not understand about the replication within the cell, the cellular cytology. We will not understand, but just overview. This is the vector is the mosquito bites. When mosquito will bite, it will transmit the virus into the blood circulatory system. Remember, this is the virus disease. This is the yellow fever is the viral disease. Remember, and the short duration for this. Virus contain enveloped E protein and the capsid protein. As well as inside is the RNA genome containing reverse transcriptase enzyme and the viral envelope. Transmission of virus after 3 to 6 days. So after 3 to 6 days, basically the transmission of virus will arise the complication and the sign and symptom of the virus. So the fever will arise, and when going into the blood circulatory system, it will infect, and after the infection, it will go into the lymphatic system in the lymph node, and where the replication site of this virus. And remember that the dendritic cell will recognize and infect the dendritic cell, but remember the dendritic cell is basically uh, recognize the pathogen and go, and even it is infected and go into the liver, and also the virus can enter into the liver, but the dendritic cell will enter into the liver. So remember that when go into the liver, so the liver and infected the hepatocytes will occur, the infection of the hepatocyte, and the infect the hepatocyte also by this virus. So let's begin to understand the steps. It when go the dendritic cell into the liver. So when go into the dendritic cell into the liver, a hepatocyte infection will occur. The process of infection we will discuss also in this video by this step. The hepatocyte infection will lead to eosinophilic degradation. The eosinophilic degradation will lead to fatality may occur once the cytokine storm shock multiple organs failure. So how it is possible? Let's begin to understand with the bigger picture of the liver containing the sinusoid inside contain Kupffer cell, while the hepatocytes also present, and on the other hand the hepatic stellate cell is present, which that inflamed by the infection of this virus, as well as the dendritic cell when go into the sinusoid, it will produce the cytokines also, as well as the infect the hepatocyte by the directly through a virus. So in this way, remember this is the Kupffer cell and the cytokines here, which that will be directly basically inflame the hepatocyte, and also infect the hepatocyte. The inflammation will increase. The dysfunction of the hepatocyte will trigger. After the dysfunction of the hepatocyte will lead to many complications like fatty liver and dysfunction of the liver even. So let's begin to understand after this infection progression within the after 3 to 6 days, the sign and symptom will show like fever, high fever, headache, headache due to some reason the high fever which that will lead to headache, and chills. Chill is due to the internal vital organ will be more heated, while the peripheral organ will be cool down, and vasoconstriction will occur, will lead to more chill because the peripheral organ will be cold, while the back pain and fatigue will occur, and the loss of appetite as well as the muscle pain and muscle itches, and the nausea and vomiting will also cause due to the dysfunction of the enzyme due to the fever arise. The fever increase will lead to nausea and vomiting due to the dysfunction of the enzyme in the digestive system, will indigestion of the food. So the infection lastly in 6 days. This is first toxic phase. If the first toxic phase will not clear due to the adaptive immune response, for example, the B memory cell and the plasma cell and T lymphocyte will not activate. In this way, the progression will be occur. The progression will 15% cause disease enter a second toxic phase of the disease, characterized by recurring a fever, this time accompanied by jaundice due to liver damage, as well as abdominal pain, bleeding in the mouth, nose, eyes, and GIT, gastrointestinal tract. So liver damage as well as the abdominal pain will feel due to the jaundice. Jaundice we will discuss in the next video, as well as abdominal pain, bleeding in the mouth, nose, eyes, and gastrointestinal tract cause vomit, contain blood. So the blood will be uh, 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 the identification due to the vomiting with bleeding. So the fertility rate is 20 to 50%, which the overall fertility rate is about 3 to 7.5%. Severe cause may have a mortality greater than 50%. So the fertility rate is 20 to 50%, which the overall fertility rate is about 3 to 7.5% severe. Let's begin to understand the little short overview about the prevention. So the prevention is vaccination and avoid to mosquito bite. So prevention through mosquito bite by the closing of the room and use the insecticides for the prevention of the mosquito bite and arrival of the mosquito in your body. And diagnosis mean the reverse transcriptase polymerase chain reaction through PCR will lead to diagnose and the, like COVID-19, and the isolation of virus and the growth in cell culture using blood plasma. This can take 1 to 4 weeks. This is that long term and basically long term process, but the isolation of virus and growth in the cell culture using the blood plasma, this can take more time. So that is why we are not using this uh, easy to understand. So just for understanding, but this is not any further use for this diagnosis. And the last one is the basically when the liver will be infected, the jaundice sign and symptom of the jaundice when arise. In this way, the liver biopsy can be diagnosed. On the other hand, the enzyme-linked immunosorbent assay will be used. Enzyme-linked immunosorbent assay we will discuss in the next video. So this video was about the yellow fever, and the yellow fever is basically is the old epidemic uh, disease due to the infection of the virus yellow fever virus, which does contain RNA genome, so the RNA virus. Anyhow, I hope you make sense about that. If you liked this video, please make sure to subscribe and like and share this video, and give the feedback in the comment below. Thanks for watching. Bye.